An audit into Australia's COVID-19 vaccine rollout has found it was not timely, didn't initially take government targets into account, and underestimated the task of getting the aged care and disability community vaccinated. The report, which was commissioned by the current federal government and released today by the Auditor-General, found the rollout has been partly effective. While 90% of the eligible Australian population was vaccinated by the end of 2021, the planning and implementation of the vaccine rollout to priority groups was not as effective, the report summary stated. Read more. Morrison's secret portfolio's a black mark on his prime ministership. The audit concluded the initial planning wasn't timely, noting plans with states and territories hadn't been completed until the rollout had already started. It also pointed out problems in vaccinating at-risk communities. Health underestimated the complexity of administering in-reach services to the aged care and disability sectors, it concluded. It went on to state, the vaccine rollout to residential aged care and residential disability were both slower than planned, and the vaccination rate for Aboriginal and Torres Strait Islander people has remained lower than for the Australian population. As of August 16, there have been 81,863 COVID-19 cases and 3,742 deaths from the virus in the aged care sector. Among Aboriginal and Torres Strait Islander peoples, 81.7% of people aged 16 or over have had 2 jabs. The figure lags well behind that of the entire population, which currently sits at above 95%. Read more. LA-based Aussie actress arrested over alleged drunken restaurant incident. Only just over 55% of Indigenous Australians have had a third dose, compared to 71.6% for the general population. However, not all of the findings were critical of the rollout. The report did note that effectiveness improved over time, pointing to the introduction of Operation COVID Shield in June 2021 as something of a turning point. Following the commencement of Operation COVID Shield, Health regularly consulted with 4 sector-specific stakeholder advisory groups, the report stated. Health put in place effective monitoring and reporting arrangements using the best available data. However, it did not undertake sufficient reporting against targets, and it does not have adequate assurance over the completeness and accuracy of the data in third-party systems. It also found there was minimal wastage of jabs throughout the rollout. Read more, explained. The Morrison secret portfolio story. Current Federal Health Minister Mark Butler used the audit to criticize the former government, saying it highlights the multitudes of failures of its vaccine rollout. The report found there was a lack of targets and, when there were targets, the rollout completely missed their deadlines, especially for priority populations, a statement from Butler's office said. The former government did not meet any of the 5 key public targets it set for the vaccine rollout to priority groups. The full report can be found here.